As you just heard, the Trump administration issued a warning after new studies showing acetaminophen, the main ingredient in Tylenol, might raise the risk of autism and ADHD in children.
Let's go to Tia now with what's behind the warning and what doctors want expectant parents to know. Tia?
Well, we learned a lot in that press conference, to say the least, but this is what we at least do know. President Trump, joined by U.S. Health Secretary Robert F. Kennedy Jr., confirmed plans to issue new federal guidance on the use of acetaminophen during pregnancy, citing growing concerns about its possible link to neurodevelopmental disorders like autism. A new study released just last month is now fueling those concerns. The research was done at Icahn School of Medicine at Mount Sinai, published August 13th, analyzed 46 studies and more than 100,000 participants across multiple countries. It found that prenatal exposure to acetaminophen may raise the risk of autism and also ADHD, especially when used frequently or in high doses. The announcement from the Trump administration also connects autism risk to low levels of folate during pregnancy, a vital nutrient for fetal brain development. U.S. health officials recommend folate, which pregnant women are already encouraged to take that supplement during pregnancy. Folate is naturally found in leafy greens like spinach, beans, citrus fruits, and fortified cereals. It's recommended to prevent birth defects like spina bifida. Still, experts urge caution in interpreting the findings because some studies have shown no clear link between acetaminophen and autism. Health groups, including the Society for Maternal Fetal Medicine, warn that untreated fevers during pregnancy can be very dangerous and that acetaminophen remains a safe option when medically necessary. And I know Sylvia and Terrence, you are about to talk to Dr. Shika Jain to explain this even further.
That's right. And Dr. Jain is joining us now via Zoom to talk about the news conference that we just listened to. Dr. Jain, thanks for joining us.
Thanks for having me.
First of all, let's get your reaction to this announcement.
So I think it's really important to emphasize the fact that they themselves said in this press conference that there is no definitive causation that's been established between Tylenol and pregnancy and autism. They said that there is a possible association. And the analogy I give is in the summer in Chicago, it gets hot. When it's hot, we eat more ice cream. And somehow we also have more crime. Does that mean that eating ice cream leads to more crime? No. That is similar to what an association is. So we can't say with confidence that there's any data currently that has been presented that shows there is a direct link between taking Tylenol or acetaminophen in pregnancy, which then results in a higher risk of autism. And also I want to mention about 45 to 60% of women who are pregnant in this country do take Tylenol. If we would think that autism was directly related to this Tylenol during pregnancy, we would expect much higher levels of autism in our communities and in our nation. So we need to take all of this with a grain of salt because I still haven't heard any factual data that showed a direct causation between taking Tylenol during pregnancy and autism.
Dr. Jain, thanks for explaining and clarifying the difference between association, causation, correlation, because a lot of times confuses a lot of people. To your point about Tylenol being safe, Society for Maternal Fetal Medicine just said today, too, that it is safe to use in pregnancy. But just you heard there in that announcement, the NIH says it's going to be conducting studies now on this and whether new warning labels will be put on acetaminophen as well. What do you want to say to women out there? What's the alternative?
So right now, I want to emphasize to women, especially if you're pregnant or trying to get pregnant, Tylenol is still considered safe in pregnancy. The American College of Gynecology and Obstetrics has said it. Many medical experts have said it. This has been studied for decades. This is not something new. There have been many trials and studies that have looked at this. And unfortunately, when you're pregnant, there are a lot of medications you can't take. Other medications for pain and for controlling fever have been proven to be dangerous to the unborn fetus, and some have been dangerous for the mom as well. Not only that, high fevers during pregnancy can be very dangerous. Viruses during pregnancy can be very dangerous. You can have seizures. You can end up with a miscarriage with some of these medications. Tylenol has been shown over and over again to be safe, and I don't want pregnant women to think that they can't control a fever or take some Tylenol during pregnancy because, again, there has not been a study that has shown it is not safe to take as of yet.
Okay, Dr. Jane, we have to talk about a drug that they brought up by the name of leucovorin. I understand it's a cancer and anemia drug. They're saying that that could be used as a treatment for children who already have autism. And I think that parents who have children with autism are hearing this and they want to know more about it. What can you tell us about that?
So I am an oncologist, and we give leucovorin to our patients, and the reason we give it is it's a very high dose of folinic acid, and we give it to protect organs when patients are receiving certain chemotherapy agents. Now, I want to remind people folic acid or folate is something all pregnant women are recommended to take to prevent neurological issues in their baby, such as a neural tube defect or spina bifida, as Tia mentioned earlier. However, folinic acid or leucovorin is not recommended for treatment currently for autism. It is recommended for people with very certain specific deficiencies, folate type deficiencies. You might need a spinal tap or a lumbar puncture to test to see if that is what's causing the autism or causing the neurological challenges your child may be having. But as of now, leucovorin is not something that is recommended or approved to be treating patients with autism. Now, if there are more studies that come out showing that there is a benefit, then absolutely there should be ways to provide that to patients. But right now, there is no real clear data that shows it is a good treatment for patients with autism. So unless a new study comes out that is a peer-reviewed, evidence-based science study, as we've done in this country for centuries, I think it's really important to emphasize we need real evidence and science-backed data to prove that it is helpful, because we want to help these kids and patients as much as we can, but we need to make sure we're giving them medications that are safe and that are going to help them. And this particular medication is only for a very small group of these particular patients.
Sticking with the theme of real clear data, I just want to fact check two things with you right now. The president said during this announcement, the Amish don't have autism was something he said. He also said there's no autism in Cuba. Anything you'd like to clarify for viewers out there and fact check here?
So I don't know off the top of my head the amount of autism rates in Cuba or amongst the Amish, but what I can say is you can't diagnose things unless patients are being seen, unless they're a part of clinical trials, unless they're seeing doctors. And it's very possible that some of these people may not have access to some of the care or the diagnostic methodology because of their location. That's the case across this country, whether you're Amish or whether you live in a rural area or whether you live in an area where there aren't as many physicians. We have deserts across the country where there aren't as many primary care doctors. So the levels of autism may be diagnosed lower there. It doesn't mean they're not there. And I want to emphasize another point that was brought up today during this press conference. Absolutely, it is a multifactorial issue that likely causes this. And, you know, the people speaking in the press conference brought up the fact that pollution, all those types of things, environmental exposures can cause a lot of medical problems. Physicians agree. Climate change, pollution, microplastics, the things that we ingest, the amount we exercise, the toxins we get exposed to, all of that may also be contributing, and they're likely also contributing to why we're starting to see cancers in younger people than we have in the past. But that does not mean that we need to fabricate information to make people fear medications like Tylenol or acetaminophen that have been proven to be safe. What that means is we need to be thinking as a nation, how do we improve our air quality? How do we improve the climate change? How do we prevent it from happening? Because all of those things likely are linked to some of the medical problems we're seeing across this country. So those are things we should also be focusing on, along with, it's very important for us to focus on autism and how we can help, but we need data and science that is peer-reviewed, and that's what this country has been so proud to be known for so many years.
All right, Dr. Jane, we appreciate you joining us and breaking this down for us. Thank you.
Thanks so much.